Happy Saturday and welcome to the Great Age Movement at Home Lab Series in partnership with the Health Museum. Today we are talking about teeth. You can't see my teeth, but they are nice. I'm with Dr. Andrew Moore.
Hi, everybody.
Welcome to the show. He was here actually last fall while we were in Nashville talking about another component of dentistry. Andrew, you're back in the city.
I am. I just moved back 2 weeks ago.
Congratulations.
Thank
Welcome
you.
back home. I'm sure your family's very excited.
Yeah, I'm very happy to be back.
Andrew is fourth generation dentist. That's very rare. And I think it's quite a story. It started with your grandfather, right?
My great-grandfather started,
Great-grandfather.
it's correct. And then my grandfather, who recently passed away, and he was a big,
Sorry to hear that.
thank you. He was a big
came to one of our
inspiration.
events with Great Age Movement
He did. He
at the
loved it.
museum.
Believed in the cause very much. He was a big inspiration for me to,
Yeah.
keep it going with the dentistry.
Did it go from, did the practice just expand and it was passed on to the next son?
Correct.
Because literally they're all
Correct. Correct. Yeah.
Wow. That's a lot of stress, isn't it, for you? That's a lot of pressure.
It is, but I enjoy it.
Yeah.
And shadowing from a young age, I just thought it was very important for, as human beings to keep our mouths healthy. And,
Sure.
seeing that as I've grown older and actually been in the field, this is, part of the reason I love doing this stuff is to educate people.
Yeah, well, just based on the legacy itself, it reinforces the kind of experience you have.
Yeah.
Because like you were saying,
Absolutely.
as a child, you were constantly exposed to it. Well, that's awesome. We're so happy to have you here.
Thank you. I'm looking forward to it.
Andrew's also on our advisory board.
Yes, thank you for that as well.
Yeah,
I'm
he
happy to
helps
be
in
on it.
all capacities. Oh, also he was volunteer of the year for Great Age Movement in 2017. So you just see his level of commitment.
It's very important to me. This organization and the movement is very important.
That's awesome. Well, today we have top 10 questions that you should ask your dentist, whether you're a senior or really anyone. And we did a little bit of a polling, and that's how we found out about these types of questions of interest. So let's start with the first one, Dr. Andrew. How often should I get checkups as a senior?
So, as a senior, typically we recommend more checkups than if you're younger. There's multiple reasons for that. One of the main ones is as we get older, our mouths don't produce as much saliva. So we have more decay and more plaque accumulation, and we need more checkups. So typically, if you're a senior citizen, we recommend every 3 months, just to keep doing cleanings and keep everything healthy.
Gotcha. Which makes sense because it's all tied into your body, and a lot of older people have chronic conditions.
Correct.
So if this is compromised, this might be compromised.
Correct. Yes.
Okay. So every 3 months. Got it. Okay. Number 2, best ways to practice good oral hygiene at home. Can you tell me the steps of good oral hygiene?
Sure. So I recommend, and as well as the ADA, the whole dental community in the United States, we recommend brushing twice a day and flossing once a day. It's very important. It's easy to kind of let it go, especially the flossing. Yeah. Everyone, a lot of people brush, but they don't floss.
Why are we so lazy about that?
It's because it takes more time and it's kind of a nuisance, but it is very important because if you think about it, the way your teeth are lined up, you're only brushing the outside.
Yes.
So we're only brushing the outside, but we got to think about between the teeth. That's where most of the issues come anyways.
And people like to see a white teeth, so they're focused mainly on that.
Exactly.
Okay,
but we got to take care of our back teeth as well.
That's right. So brushing your teeth twice a day, is there specifics on, what's in your toothpaste? What kind of toothpaste?
Yeah,
how
so
you
that's
brush your teeth.
Definitely how you brush is a big one, and what kind of toothpaste you're using. So I always recommend anything with fluoride. You can use what you want, even organic, Crest, whatever works for you, as long as it has fluoride.
Now, does the organics have the fluoride?
A lot of them do.
Okay.
Yeah,
gotcha.
Tom's.
It
I know
seems like
Tom's
that's
does.
pretty standard fluoride.
It is. It is.
Yeah. Does the city put that in the water too?
They do. They do. So the city actually puts fluoride in the water purely as a dental health means. So
interesting.
That was actually a big community health production that has really helped save a lot of our teeth and prevent a lot of dental issues.
That's really amazing. I was wondering about the connection, right? So I didn't know it was specifically designed keep our oral cares up.
Hmm.
Okay, now in terms of the floss, I think in the past because there's so much advancement with floss products.
Sure.
For me, I was always annoyed to wrap around the finger, and
Hmm.
then
Yeah.
it really kind of
It can hurt.
hurts a
It can
little bit,
hurt.
right?
Yeah.
Get like ulcers. So, and then they came out with the one that has the pick on one side,
Hmm.
and then they have the tight floss on the top, which to me sounds like an easy bet to
It is.
encourage people to floss more.
Exactly. So that's what I use personally. The standard and the best way to do it is the string, but
Yeah.
realistically, if you're not going to do that, just use a floss pick one because the idea is to remove food between the teeth.
That's right.
So as long as we can get up in those areas with something, it really prevents a lot of further issues.
Sure, and I feel like that pick really pushes like the bigger food products that
Yes.
get stuck in your teeth
Yes.
out first.
Yes.
So allowing you to really get that floss in there.
Hmm.
Great. Okay. And what about the mouthwash? Does that help at all? Like,
So mouthwash is great. It also has fluoride in it. Some of them have alcohol, which can kind of help kill bacteria. If here's the thing, it's not a substitute. So
Yeah.
You got to still brush and floss. It's kind of an adjunct if you want to do it.
Yeah.
But brushing and flossing, as long as you're doing those two things, the mouthwash is helpful, but you can't only do that if that makes sense.
Gotcha. I think it would be good for people who are so busy working. They get their teeth brushed in the morning, the evening, and in the middle of the day, it's nice to like
Yeah, absolutely.
throw it in there because
Mhm.
all that food and
Yes.
coffee
Yeah.
and everything else that you're doing.
Yeah.
is
It's
just
good to
kind
wash
of
it out.
sitting in there. Right?
Yeah, absolutely.
Excellent. Okay. How do I prevent tooth decay and gingivitis? First, explain what tooth decay is.
Okay, so we all have teeth that we can see, correct?
That's right.
So tooth decay happens when either food or acid sits on your teeth for too long,
Okay.
and it starts breaking down your tooth structure. So think of like like a tree with the
Uh-huh.
wood. It starts rotting and it kind of gets soft, right?
Yeah.
It's kind of the same idea with teeth.
Oh,
So
okay.
when that happens, we have to drill it out until it's good, healthy tooth structure and fill it.
Ah.
But we don't want to let that tooth decay get too deep, or we may need to get a root canal at that
So
point.
you get to a certain point, you just have no room. You have to actually do the root canal.
Yes, if it gets into the nerve, it can start hurting. So
Ah,
kind of a little tangent, but
yeah.
that's also another reason that we need to, keep our teeth free from
But
decay.
it seems like a lot of people get root canals. I hear it. Like,
It does happen, and sometimes you can, you're just bad luck. And
is it more so with older people, the root canals, or is it?
so
any age?
as we age,
Yeah.
we wear our teeth over time. We can just develop cavities even if we're, doing things the right way. Sometimes it truly just happens. But decay is typically the cause of root canals.
Gotcha. So
Yeah.
if you go back to the prior question, and you
Sure.
brush your teeth twice a day, and you floss,
Hmm.
as the dentist recommends,
Yes.
you can minimize
Prevent
that
that.
kind of that.
Correct.
So tell us about gingivitis. I know itis means
Sure.
inflammation.
Yes.
So tell me about.
So you're right. Gingivitis is inflammation of the gums.
Okay.
So
What triggers that?
what triggers that is when you have food sitting on your gum line, and it just causes your gingiva to get red. All that bacteria causes your gums to get red and inflamed.
So the leftover particles are just breaking down in your gums.
Yes, and it's
Ah.
it's causing a lot of inflammation. So the first stage of what happens is called gingivitis. That can progress to what we all know as periodontitis.
Okay.
A lot of people get diagnosed with this disease. It's kind of a silent disease.
And for the audience, real quick,
Sure.
many people already know this. Tell them what periodontal means.
So periodontal is the surrounding structure, the bone and the gum surrounding your tooth.
Okay.
So periodontitis is the breakdown of that. Gingivitis is the first stage when just your gums are inflamed, but if you leave all of that too long, it can harden and cause periodontitis, and it can start actually destroying your bone.
Wow. Which is a much bigger problem.
It is.
Yeah.
It is. And then you start, your teeth start getting wiggly, and then you can lose them.
So of the measures we talked about, brushing your teeth, flossing your teeth,
Mhm.
using as an adjunct mouthwash,
Mhm.
what other things can you do to? Should you be stimulating your gums? I know that some
there
toothbrushes
is
have
there
those
is
little
some
things on it too.
Yeah, so electric toothbrushes, that's part of the idea there as well. It's kind of, stimulating, it cleans better on the gum line as well.
I got you.
Yeah.
Okay.
But the
Um,
most important thing is just removing all food particles and
all
bacteria.
food
Another good thing that I like to recommend is water picks. Those are good at cleaning out
particles.
stuff in between teeth.
Okay. I think a lot of us wait to go to the dentist for that one.
Yeah, unfortunately, that is true.
Yeah. But also, I think before the show started, we talked about what you do, other things you can do between brushing your teeth during the day when you're so busy.
Sure. Yeah, sure.
You were just saying just
Yeah.
gargling water and
Yeah.
physically using your tongue to
Yeah.
wipe
Try
the
to
teeth.
try
so
to
that
just
it sits there.
yeah. I think it's like important to consciously just be like, oh, I just ate. Let me switch my mouth out with water to make sure I don't have leftover food.
Yeah.
Even if you can't, because realistically, after lunch, I don't have a toothbrush with me.
Yeah.
So I'm like, okay, I'm gonna rinse, wash it out real quick.
Yeah.
Mhm.
Okay. Very interesting. All right. So let's go on to our next top 10 question. What is tooth sensitivity and why do I have this? I've had this before.
Me too. I do as well.
And
Mhm.
I always thought it was just like very cool things trigger it,
Mhm.
but something I've been doing has made the tooth more sensitive. Actually, collectively, the teeth.
Yeah,
So,
sure.
and then it disappears.
Yep.
And then it comes back. So
Mhm.
tell me about the process.
So our teeth over time, our gums just naturally recede as we chew. Our gums take a lot of force. Our bone takes a lot of force. Over time, as we age, our gums can just kind of go up. That exposes more of our tooth. So when we drink something cold, the tooth that is exposed that wasn't previously exposed isn't used to that sensation.
Oh, so the gum is receding up and exposing what was below the surface
Yes,
of the gum?
exactly.
Oh, that's where the, okay.
Yeah. So it's a sharp kind of sting.
Yes.
And I get that as well. And I think my reason is I used to brush way too hard.
Yeah.
That can also expose that part of the tooth.
Yeah, I had that same issue
Mhm.
when I went to the dentist.
Yeah.
But I switched to the electric toothbrush.
Yes,
and it
very
makes a
helpful.
huge difference.
It does, absolutely.
It's an adjustment because I feel like initially I was trying to make it go faster by moving my hand, but you really just have to hold it and it takes care of itself.
Yeah.
Which I think benefits a lot of seniors.
Absolutely. That if you
get
exactly.
thorough cleaning.
With
Yeah.
mobility issues, and I know you were going to ask,
Yeah.
but with arthritis and mobility issues, I always recommend a electric toothbrush
Yes.
because you don't have to do as much work and it's not as much stress on your joints. Like you said,
That's
it kind
right.
of
And I think the handle is much wider than a
Mhm.
typical toothbrush.
Yes.
Yeah. I think that's definitely worth the investment.
Absolutely.
There. Now, if you do have sensitivity, I know there are some toothpaste.
Those
I used to buy
yeah.
these Sensodyne.
Mhm.
But what other measures can you do? Is there like a topical you could put on your gum or something?
So those wouldn't really be effective. I would
Yeah.
say Sensodyne. Sensodyne helps a lot because it has a lot of fluoride and it has some protecting agents that can kind of seal up that part of the tooth.
Okay.
Also, if you are interested, you can get a gum graft. That's
Oh,
a whole nother
I think
thing
I've heard of
where
that.
that's a whole nother thing where a periodontist, a dental specialist, will graft your gum and place it over that part of the tooth. But
Are they taking it from the palate? Or
typically,
Really?
yes.
So they just take the shaving of it and then they transplant it?
Exactly.
How long does that take to become
Integrate
part of, integrate?
months.
Yeah. Does this happen often, the grafting?
It does. It's typically up to the person if they want it or not.
Sure. It's more of elective, right?
It is more elective.
Okay.
Yes.
But it treats the pain.
It does. It does. Yeah, and protects your teeth.
Cool. Okay. Our fifth question is, what are dental implants and when should I consider them?
That's
If
a good
ever?
question. Absolutely. So if you're missing teeth, you could be a candidate for a dental implant.
Okay.
It depends on a lot of things: your bone density, your medical history. If you have history of osteoporosis or other bone diseases, or if you've had radiation to your jaw, you're not going to be a good candidate. But if you're missing a tooth and a lot of people get a tooth pulled
Sure.
and they miss that area of chewing. So dental implant is when you get an implant, it acts as the root, you drill it into bone, and then so it's essentially just putting another tooth inside of a space that you're missing a tooth.
Gotcha. And then the crown itself just holds it all together? What's the crown?
So the implant holds it. The
Yeah.
crown is just for chewing. The crown is like replacing the tooth that you can see.
I
now.
see.
Yeah.
Okay. So
But it's very helpful and It's very helpful, and we recommend it, and there's a lot of great science and technology behind it nowadays.
Now, once the implant is in, which, as we said, if you have osteoporosis, the problem could be because you're putting it, anchoring it into the bone, right?
Correct.
So does this last forever once you have it in your?
So you still have to keep it clean. That's a good question.
Sure.
Very good question. If you have dental implants, you got to keep going to your cleanings and getting cleanings because the bone around it still can get disease. So sometimes people think, oh, I have an implant. It's not a tooth, so I don't need to care for it anymore. But you really need to take good care of it.
Okay, that's worth knowing. Let's talk about types of mouthwash and should I use it regularly? We did mention earlier about
Sure, yeah.
mouthwash, and I know there's over the counter, but I've had some clients that have the prescribed version.
Sure, those are
Especially
great.
for very painful, like aspects of the mouth.
Sure. So we do prescriptions sometimes, especially if you're getting dental work done. We'll do like a chlorhexidine rinse.
Okay.
That's a good. It kills bacteria and helps you prevent infection.
Yeah.
It is good to use mouthwash if it has fluoride, but
now why aren't these over the counter? It's because it's something.
It's
you
a
have to
strong.
monitor?
Yeah, it's a
Okay.
stronger medication, and it's not something that would be beneficial for everyone.
Yeah. So if somebody has like lingering bacterial infection,
Exactly.
this will make it heal quicker.
Correct. Yeah.
Got it. Okay. Now we're moving on to, as we age, what are a number of circumstances that work against good oral care?
So, would you mind re-asking that?
So basically, what circumstances work against your oral care? I know,
Okay. Yeah. Sure.
if
Okay.
you're not maintaining your teeth,
Yes.
what are some things that could eventually happen?
So, a lot of things. So, essentially, the mouth can get disease pretty quickly.
Yes,
If we stop caring for our teeth, decay is one, periodontitis is one.
that's right.
If you're smoking, you can get a lot more issues, a lot of cancerous
Sure. That dries out the
concerns.
mouth, too,
It
doesn't
dries out the mouth. Yes.
Yeah.
So the bigger, more common issue is dental infections, and that's when the decay hits the nerve or periodontitis goes to a point where our mouths are getting infected, and that could actually end us up in the hospital, and we see it a lot.
Yeah. So tell me about what could happen if you have this infection and it gets serious enough, it involves the rest of the body, like
It does, absolutely.
So what are some conditions you can have?
So if
this kind of infection in relation to the body.
Sure. So if you already have heart issues, endocarditis, and bacteria getting lodged into your bloodstream is a big concern, and we really try to prevent that in those patients. There's a lot of Lugwin's angina where if the bacteria hits into your nerve, your throat can get swollen, and your airways can collapse.
What is that called again?
Ludwig's angina.
Ludwig?
Correct. Interesting name, named after the guy that came up with the term.
Show, Ludwig. Angry, oh wow, that's some serious stuff.
So it's
Which makes sense because you have to eat in order to survive.
Sure.
And drink fluids.
Yeah.
So if you don't take care of the entrance,
exactly,
it's going to impact everything down the road and down the tunnel.
Yep. Absolutely.
So okay, great. If I don't have any natural teeth, why do I need to go to the dentist?
That's a good question, and a lot of people ask this, and I
have teeth, by the way.
You do. They're very pretty. I get asked this a lot, and I understand where it's coming from, but to answer the question, you can still get issues in your mouth. You can still get sores. You can still get lesions where we need to keep and make sure your gums and bone are healthy.
Let me ask you this: so if you lost all your teeth, and the entry point of where the tooth is in each of those sections, it just closes up the gum?
It does.
There's no entry point,
correct.
not even a tiny little.
So for a few weeks there is, but when we lose a teeth, we have a socket.
Okay.
And that socket eventually will just fill up.
Okay.
And close, and it heals.
Okay.
So if as y'all know, if you have dentures, you don't have those holes anymore. It's kind of just a smooth ridge, as we call it.
Yeah. Got it. And then speaking of dentures, not to sidetrack, but people who do wear dentures, I've noticed with some of my clients, they may skip wearing it for a few days just because they're feeling lazy, but eventually it seems like if you miss too many days, suddenly they're not fitting properly. So do your gums just start to change?
So your gums can form. They like to stay in form of what you're putting on them. So
Okay.
if you're wearing dentures and you're wearing them like you should, your gums are going to fit the dentures better. If not, they kind of take shape on their own, and they cannot fit as well if you don't wear them for up to like a week or so. They're not going to go in as well.
Gotcha.
That's a good observation.
Yeah, which becomes expensive because when you go back in, it's not, they can't manipulate the denture itself. They have to give you a whole new set.
Correct. Yeah.
Wow. Okay. So definitely floss your teeth,
Mm-hmm.
wash your teeth, brush your teeth, do all the things to prevent a lot of the things that you have to encounter as a dentist.
Absolutely.
We're on question number 9, which we did briefly mention, which is what should I do if arthritis is affecting your ability to floss and brush your teeth?
Sure.
Is there an adaptation for the floss for somebody who has trouble doing that?
There is
something
not,
out
to my knowledge, but the floss picks are a lot easier than
Yeah.
the string. So that's what I would recommend if you have arthritis.
Yeah.
Um,
And I think if you go to the dentist every 3
Exactly what I was
months as
gonna
you're
say.
older, it
Mhm.
can help with the things that you're having trouble doing.
Exactly.
Yeah.
Exactly what I was just going to lead up with. Yeah.
Good. And then obviously, as he said earlier, the electric toothbrush will help tremendously.
Mhm.
You know, in fact, some people, if they're sitting and they say if they're in a wheelchair and they need to brush their teeth, if you place them on a counter, they can use their elbow for support to support the arm essentially,
Sure.
and they can brush their teeth.
Mhm.
That would be an
I like that.
adaptation.
Yeah.
And the last question we want to ask you today, Dr. Andrew, what does oral health have to do with the rest of my health? And we touched on that a little
Sure.
bit, but do you want to just give a summary of
Yeah,
how that
absolutely.
all works together?
So your oral health is real important into, protecting the rest of your body. Everything we consume goes through your mouth, right?
That's right.
And our mouths are entry points to bacteria and other things, things that we don't want in our bodies.
That's right.
But if we have all that food and bacteria, it can kind of just sit in the bloodstream and cause a lot more issues. There is tentative links between having periodontitis and heart disease, and they're starting to figure out more and more about how
It connects to other
it can yes,
Got it.
and it can exacerbate and make other conditions worse.
That's right. And having your teeth, this is just a side note, your teeth are not just for chewing, but if you don't have teeth, it also affects how you speak because you don't have
Yeah, absolutely.
the ability to have the teeth to separate and help the enunciations,
Yeah.
etc.
Yeah, a lot of things that we don't think about that
Yeah,
our
things
teeth
that
do
we
for
take for
us.
granted are
Yeah.
actually very important. Speaking, eating, and enjoying life.
Absolutely.
Well, listen, this has been very informative. We
Yeah,
thank you for
thank you.
answering the top 10 questions. We're going to be right back. Dr. Andrew has a little ab workout that we're going to do together. He gave it to me in advance. I'll lead it, but just know this is how he keeps his six pack. We'll see you right back after this brief intermission. And welcome back. We decided to give you a 10-minute sit down ab workout with Dr. Andrew. First, we're going to start with a stretch. Place your hands on your knees. You want to be on a solid surface. And remember, this is instructional. Always check in with your doctor before you do any exercises. If you feel faint or pain, please stop. But just know this is instructional. Here we go. We're going to drop our head, look down at our lap, and we're going to round out by pressing our abdomen towards the spine. Stretch that back out. And then we're going to look at the ceiling. Good. Now we're going to do that 5 times. Let's round out our back, press our abdomen into our spine. Feel that stretch. And then come right on up. Look as far as you can towards the ceiling. Keep your back nice and straight. Good. And again, number 3, rounding out our back. Looking at your lap.
Feels good.
Yeah. And come back up. It's always good to do a warm up before you do any exercise. And of course, drink lots of water.
Mm-hmm.
Number 4, rounding it out. And then looking up. Just like your body needs exercise, your teeth need flossing. Don't forget. One more. Contact the back. And look at the ceiling. Excellent job. That's a good way to start with your stretch. Now what we're going to do, for those who can, place your hands behind your neck. And if you can't, you can always place it on your shoulders, or you can cross your chest if you have limitations in your shoulders. What we're going to do here is we're going to do leg lifts. So we're going to start with our right leg. Keep your back nice and straight, and we're going to raise that 5 times. Here we go. 1. Now you're going to use a 2-second count like this. 1, 2. And you should be tightening your core as you raise your leg. 3. I'm digging this music.
I like it.
4. Good. Back nice and straight. And 5. Excellent. Now we're switching to your left leg, keeping your back straight. Here we go. 1. Like I said before, you can cross your arms here if you have trouble. Keeping your hands behind your head. 3. 2 more. Tighten your core as you raise your knee. 4. 5. Excellent. All right. Now, generally I do about 10 to 15, and I'm sure you do way more. You can add ankle weights if you need a little more resistance. You can always modify your exercise. We're just showing you how to do the basics.
Mm-hmm.
The next thing we're going to do is we're going to 2 different ways. You can place your hand behind your head, or you can do across your chest. Andrew's going to do behind his head, and I'm going to do across my chest. To modify for those that have shoulder issues, we're going to lean back and pull forward. Using your core, tighten it up as you come forward. Your core is essential to your balance when you walk, when you get up. 2. Good. And a 3. Get that breath in there and blow out. 4. Going to 10. 5. Great way to start your Saturday. A little bit of exercise. 6. Tightening that core. 7. 3 more.
Oof.
8. Inhale. 9. Last one. And great job. All right, Andrew. Let's see. Your
Feeling
fourth
loose.
one. I had to practice these last night when you gave them to me. Now we're going to do around the world. This one's using your core all the way around, your abdomen muscles, your obliques, and your lower back. You're going to place your hands behind your head. You're going to drop your upper body, keep your back straight, look at your knees, and then do a round the world. So that's right, slightly lean back, come forward.
A good lower back stretch.
Yeah. Keeping it all above the hips. 2. 3. 4. 5. Halfway there. 6. 7. 8. 2 more. 9. And awesome. All right. And then you would go the other way. But we're just showing you some instructional exercises for your core that you can do anytime.
Mm-hmm.
You're in an office, on the couch, just find a solid surface. And it's always best to sit at the front of a solid surface. Makes it easier, gives you better control. And of course, the music's always a good thing. Okay, the last thing, number 5 of our ab workout, is placing your hands again on the back of your head or shoulder. And we're basically bringing the elbow to the hip, each side. Here we go. And to our left. 1. Other side. Remember, there's 2 sides. We only count on one side. 2. And 3. Inhale on your right. Work those lungs. 4. And 5. Inhale. 6. 7. Inhale. 8. Last 2. Inhale. 9. And 10. Inhale. And like Taylor Swift says, shake it off. All right. Good job.
That was
Dr.
fun.
Andrew.
Yeah.
High 5 in the air. Boom. Thank you, everyone, for watching our show. As I've said before, we're about seniors, about entertaining, instructing, encouraging, and living by example that seniors are important to all of us.
Absolutely.
And during this pandemic, it's been challenging for many who are sheltered in place. And we just want to be in your homes to show you how much we care. And every Saturday, we have a new topic. So we look forward to seeing you next Saturday, 10 a.m., Great Age Movement Facebook page. It's also on our website and in partnership with the Health Museum. So we'll see you and enjoy the rest of this beautiful weekend. See ya.
Bye, guys. Thank you so much.